look at us.
Thank you so much for giving up some of your evening and joining us live now to talk about the virus, obviously, which is on everyone's mind right now, and everyone's got a lot of questions about this. So you've been ahead of the game being in America and being firsthand kind of helping people and like becoming quite an expert, because you are an expert in viruses at the moment, and now you've just added coronavirus to the pile. So Tom, tell us what you're seeing.
Oh my God, Shelley, thanks for having me on. I think I'm seeing what a lot of people are seeing is, I mean, a lot of people are kind of freaking out by this whole thing, you know, and that's really kind of the biggest thing is there's a lot of hysteria. People don't know really what to do, and they're concerned. I mean, you look at the news from last week to this week. I mean, we went from having, 1,600 cases to having over 16,000 in a week. So it's ever emerging, and people are just concerned.
And what do you think is the biggest cause of concern for people? Like, what are you seeing with your patients? What are you seeing with the population? Is it the fact that there's no cure that we know of yet, that it's spreading so fast, that it's so contagious? Like, where do you think this fear is really coming from? Like, what is causing it?
Yeah, I think a lot of it is the unknown, and the lack of a clear message that we've been given. I mean, in the beginning, we said, hey, look, this isn't a big deal. Don't worry about it. It's a China thing. And now it's like, holy crap, it's a huge deal everywhere. And I also think that, with what we've heard coming out of Italy, that's really scary, and I'm trying to ask people to, let's get the facts straight as best we can. Let's minimize our panic so that we can take proactive actions. But we're all going to be scared when you see some numbers like we see coming out of Italy, right? I mean, it's just crazy.
And what do you think is the reason for the spread of it? Just because it's so contagious, just because people aren't taking it seriously, they're not isolating? Like, where do you think we're going wrong, or what do you think we could be proactive about doing?
Well, I think here in the United States, we didn't take it seriously in the beginning. We didn't have testing available. We know, like in South Korea, it started to get out of control, but then they initiated wide-scale testing and sort of drive-through testing, and they've been able to really start to contain it. And countries, and it sounds like what you're doing in New Zealand, people are taking it very seriously. And the more seriously we take it and the more we plan, it seems like people are doing better that way.
And testing-wise, though, Tom, we haven't been very ahead of the game with testing. What sort of testing are you talking about for New Zealanders that don't know much about it yet, because that hasn't been rolled out here?
Yeah, well, the testing that we really need to be thinking about doing are things like if you have symptoms consistent with COVID-19 they do a swab in your nose and in your mouth, very much like influenza testing. One of the important things I was talking about for a long time here, and you guys should be aware of, is, and we follow your government's recommendations, obviously, but unless you're really severely short of breath and you need an ambulance ride to the hospital, if you think you have symptoms of COVID-19, the best thing to do is take a deep breath, sit down on your couch, and call your doctor. And the reason that we've been recommending not just showing up is maybe testing is not available. And if it's not available, you just went to a place and potentially made healthcare workers sick or other patients sick when you're not even going to be able to get that care that you needed or the testing. But sometimes, more than 80% of people, and it's even starting to look closer to 90% of people, are going to have mild disease. It's going to be like the influenza or maybe even less. And your doctor may say, hey, you know what, stay at home. We'll call you later today. Let's check in tomorrow or whatever, so that you don't have to come in. I mean, the thing we're seeing in the United States is, as this is rolled out, the medical system has been overwhelmed. We just have too many people showing up places, and then we're actually spreading it more than we need to. So they may ask you to just stay home. Or one of the cool things that people started in Connecticut and Vermont, and I know they've done it in other places in the country now, is you could call, make an appointment. You show up in the parking lot, you stay in your car, you call again, and then they have somebody with all of the protective gear on come out and assess you, tell you what to do. If you need a test, do the testing, and then tell you what to do. But that person is going to now know how to utilize their personal protective equipment keep themselves healthy and safe and keep other people. Because one of the things we're seeing is a lot of doctors and nurses and support staff are getting sick. We've had some doctors die in the United States. So that's kind of a scary thing. We don't want to be putting people at greater risk because we need them for when the people are most severely ill. So it's been one of the tactics that's, kind of worked. So that's kind of cool.
That's an awesome tactic. That's really cool, and it's really proactive, and it's really cool. So the testing you're talking about, how long does it take to do? Like, is it a blood test? Is it, well, it's obviously the swabs. Then does it take an hour? Is it like 24 hours? Like, how long does it take for the lab to work it out?
Yeah, the current testing that we have really takes, about 48 hours to get a good result. We are looking for blood tests. I've heard that you can do it in several hours at certain places. The stuff at the United States, I don't think we have results coming in that quickly. But the good news is if we do a test for you, we can offer, we could suggest quarantining. And once we quarantine that person, we also want to do what's called contact tracing, which is say a friend of mine has a cough. I hung out with them at the coffee shop. They suspected of COVID-19. Now what we need to do is go back and they give me a call and they say, hey, Tom, stay in your house until we know what's going on with this person, so that we don't spread it. Because one person can infect many, and that can help us. So that being able to do accurate testing early on is really important for slow the spread.
I 100% agree. I was telling you, Tom, just before we went live, that we've got 40,000 people coming back into New Zealand this weekend. And I personally want every one of them swab tested before they get, as they get off the plane, because I'm like, how do we not know that they're not bringing back something? And let's just quarantine them and be 100% sure. But that's just my idea. I'm not the government, obviously.
Well, right.
One of the fears, or one of the concerns that we're seeing a lot of in the media, which I think personally is spiking some fear, is how serious, if you catch it early on, is there a delay in terms of with influenza, it can turn into a bad cold. It's more than a bad cold. I've had influenza personally, so I can say how bad it is. But it doesn't necessarily kill you. What we're seeing in the media is if you don't catch this fast enough, next minute you're almost can't breathe properly, suffocating, and dead. That's kind of the story. I've generalized it. But that's where I think some of the fear is coming from. Is that true? If you leave it a day or if you leave it 2 days, if you're self-isolated at home, I'm not saying spread it, but I'm meaning if you're looking after yourself and you're just oh, maybe I've just got a cold, I've got a flu, we're about to go into winter. Do we need to be concerned? Is it something that you need to be super proactive with and straight away get to the doctor to do something about it? Or can there be a delay?
Yeah, what we're seeing is that for the most part, we're getting the fever, the cough, and the shortness of breath. The cough is usually a dry cough, meaning stuff's not coming out, not that big green goopy stuff you get with pneumonias and stuff. But usually after the onset of symptoms, of those classic symptoms, in 2 or 3 days, if you start to develop shortness of breath, that's when you need to call someone, because it can be within 1 to 2 days you're getting severe illness. If you have just kind of I'm not feeling well, we're doing, I've got the fever and the cough, most people are going to do fine and recover in a week or two. They're not going to, necessarily rapidly progress. But again, as soon as you hit the shortness of breath stage, that's when sort of the time starts ticking. Now,
and Tom, just for people that don't understand, what does shortness of breath mean? Are we talking about when we've been for a run and we're really unfit? Or are we talking about our rib cages are feeling really tight? We can't breathe? What is shortness of breath, just in terms from a medical point of view? How do you define that?
Yeah, it's kind of all of those things. It would be any kind of thing where you are having a difficult time breathing that's abnormal for you. So as an example, if you happen to be overweight, you started working on it, but you're still short of breath when you go up the flight of stairs, that's probably not, if that's your usual way of being, that's not a thing. But yeah, anytime you see a change in breathing, it's a big deal. And this is primarily a lower respiratory infection. So we do see a little bit of upper, sore throat and nose stuff, but it's very uncommon. It's more sort of just down with the cough and the breathing. We do know that there are some modifiable risk factors you can start working on. If you smoke, you got to stop smoking. That is one of the highest risk factors.
What about vaping?
Vaping is very bad as well.
Vaping, whoops, clearly I don't vape at all or talk to vaping.
Yeah, I wouldn't be doing that either. There's no way. You got to stop doing that too. No, and there is some evidence that vaping leads to increase in acute respiratory distress syndrome, or ARDS, and so that's what a lot of folks are ending up essentially developing out of this. And it's more of a description of what happens, but all it means is it's like really bad and you might not make it, right? So if you smoke or you vape, this is definitely the time to quit, because it's definitely not going to, it's not safe. Other things, people should be aware that the vast majority of the people who are dying or who are sick, severely ill from this and close to dying, are people who have more than, multiple medical problems. Some of them could be asthma, lung disease like emphysema or COPD, diabetes, especially uncontrolled, heart disease. And when you look at the information out of Italy, where they have almost an 8% death rate, they just had a study come out in the last 24 hours showing about 48% of them had 3 or more medical problems. And almost everybody had more than one. So what we know about Italy, which might be helpful for other people to hear to help calm some of our nerves, is that they're the second oldest population in the world behind Japan. So we know that age over, a lot of people are saying 60. The big inflection point really happens at 70.
Yeah,
so 70 and 80 are really where people are dying. So they have the second oldest population in the world, and they have a huge population of smokers. So this is the time where we can stop. We know that the scariest place on the planet right now has people who have multiple illnesses, they're older, and they're still smoking. So then I just put an article out yesterday too about millennials, because a lot of people are like, oh, well, that's good because old people, aren't getting sick. If I don't smoke, I'm not getting sick. But what we do know is in the first couple thousand cases in the United States that came in, like were U.S. cases, not imported, there's a mix of people who are getting sick, including people who are in that millennial generation. And it's not just smokers. The smokers and the older population still have the worst outcomes, but tons of people are getting sick. So we have to really take it seriously. And I think that that's what's happened in the US, is we didn't really take it seriously in the beginning.
Got it. So then if it's people so what you're saying is if they've got a condition, they've got a weakened immune system, right, Tom? So can we be doing anything to support our immune system on the lead up? Like what can we, in New Zealand at least, we've watched you guys, we've watched Italy, we've watched Japan, China. Can we be taking a proactive approach? Like, is now the time to actually, if you didn't care about your health, now whip it into shape as fast as possible?
That would be my recommendation for sure. And no matter what,
is this enough to motivate people to actually take their health, or are we just going to sit back and still just watch it happen?
I don't really know, Shelley, and I do think I'm wondering what people are really going to do. It's really kind of crazy because, I've been telling everybody, look, there's stuff you can do right now to help prevent yourself from getting severely sick from the coronavirus. But what about the long run? We will get past this. And now, is this going to motivate you, to take advantage of the amazing system your body has? I was just talking to actually JJ the other night. She was telling me about this meditation and EFT study. And I've seen previous studies on EFT tapping where you can bump up your immune function. But they did a 7-day meditation EFT combination. And within those 7 days, they can increase your salivary IgA levels by 118%, which is essentially a doubling of that particular immune cell and so you can do it with simple things. And I've been telling everybody, this is a time to stay on a routine. It means going to bed. And if you're an adult, getting 8 or 9 hours of sleep. If you're younger than adult, you need more time and you need to get that sleep. It's so critical. To help you can turn off your screens and earlier in the evening. Certainly, if you don't feel like doing that, blue blocking lenses are really helpful to block out some of that blue light that messes with your melatonin. Turning off your Wi-Fi at night while you're sleeping, it can be very helpful for people with insomnia to sleep more deeply. And then the other thing is we need people to get up in the morning, because one of the reasons people don't go to bed is they don't get up. So if you're having trouble with insomnia, you can actually get yourself out of bed in the morning, maybe force yourself out, so to speak, get outside, get some fresh air and get some sunlight. If you can't get sunlight in the morning, certainly there's all kinds of little like light boxes and blue light glasses. Like I use Retimer, I believe that they're out of Australia. But the bottom line is get up in the morning and get outside. And as an osteopath, we were always taught about what happened in the Spanish flu epidemic of 1918. And the osteopaths had like a 10-fold decrease in morbidity and mortality, so death and then serious complications from the Spanish flu compared to other people. And what we see is that what they did is they said, look, if you can get out of bed and walk outside in the sunshine and the fresh air, do it. For two reasons. One is we want that fresh air circulating. The other one is the lymphatic fluid, or the system that cleans a lot of the bacteria and viral debris and stuff, and also is part of telling your body like, hey, this is a foreign invader, identifying it and going after it, and then cleaning it up is the lymphatics. So in our arms and our legs, we need muscle contractions to move that fluid, and in our chest and our belly, we need to actually breathe deeply and change pressure gradients. And so if you can't do that because you're sick or you're old, or you have another condition, like maybe just got injured, or you're just older and you're not as mobile, just open the windows for 4 or 5 minutes a couple times a day and get some fresh air circulating. And if you can't go outside, maybe you can jump up and down inside a little, just kind of, even if it's just like I'm just sitting on the chair, just like bounce up and down on the couch, get the fluids moving.
That's like dancing. It must be good, Tom.
It's totally good, Shelley. And the cool part too is like if you can't move, you can actually shake somebody's feet when they're lying down, and they go like this, and you get a fluid wave. But this stuff seems ridiculously simple, but it works, So when in doubt, just schedule a live dance-a-thon with Shelley, and your health will go through the ceiling.
Yeah. Saturday and Sunday mornings, and Tom, it's very clear I can't dance, so it'll be heaps of fun. Maybe I need Taylor Swift on, and then off we go.
What is that thing they have? We have some dance thing for the Wii.
Do you?
Talia has. It's amazing. It's just like you mimic all the moves.
Oh yeah, yes, that's a good one. Maybe we all need to get technology out and get that on, like for the bit. Yes, good thinking, Tom. So, Tom, is there anything else from what you've seen over in the States, obviously, that we can be proactive about? Like for a second, and we talked about this just before we went live. How important is social distancing? Like there's a lot of, when you talked about the millennials, from what I've been reading is the millennials can carry this virus without even really realizing it. And often they're just getting very, not very severe symptoms. So they might just get the cough or whatever, but it's enough for them to just carry on with their life. But a difference from my understanding between like influenza and coronavirus is how contagious it is and how spreadable it is. So how important is this social distancing at the moment?
Well, in the U.S., I mean, it's the horse is out of the barn at the moment, so to speak, and I think it's extremely important for two reasons, and the number one reason, well, I guess they're probably equally important. Is one is like you said, we are learning that we can have asymptomatic spread, and one of the biggest things with influenza and with the coronavirus is you can spread the disease to somebody else before you get sick.
Yeah.
And then, and then also you can have people who are like asymptomatic carriers, so maybe the young population, like in the US, we've not had a death below 19. And I think China, the youngest was 14. So our younger population seems to not be getting sick as much. And they also seem to be less susceptible to serious side effects. But the problem is, like one of the things that I got asked last week by somebody was like, hey, we live in New York City. My kids have been going to school. This is before everything changed over the weekend, and they're like, but this weekend, we're going to go visit my parents. They're 80. They both have diabetes and they live in Florida. I'm like, no, don't do this, because you could be like a Trojan horse and bring that in, and they wouldn't even know. So it's just one of these scenarios where you have to think about the exposure risk. And, like I know in New Zealand, there's very few cases, but they are increasing. And hopefully what you guys are doing is testing them, quarantining them, and doing contact tracing, looking for who they've been in touch with. And usually what we do with self-quarantining is asking people to wait for about 14 days in self-quarantine, because the virus, after you're exposed, you generally get sick 5 to 7 days later. But it can be anywhere as quickly as 2 days and upwards of 14 days. So that's where those numbers are coming from, but it's really important to take it serious early on, because what you see is here, we were told it's not that big of a deal, and it was very blasé. And next thing you know, literally we have a tenfold increase in the number of cases from last Friday to this Friday. And I know realistically, the US has probably had tons and tons and tons of these cases that we just didn't even know about that were mild. So we're going to have to look over time to see what happens. But the reality of this situation is, we do need to isolate people. The other part about this is the reason we do social distancing too is not so much to stop the number of cases once they've kind of been out, but what we're seeing in the United States is a huge spike, and we're seeing that our emergency rooms and our critical care units are being overwhelmed. So by you taking a step back and sort of doing the social distancing, you can actually help prevent the spread to other people, but also just decrease they call it flattening the curve. So we're looking at the number of people who get sick at one time. And by you doing this, you could potentially enable someone else who has a serious medical case of this, who could die, to actually get the care they need and make it. So we have to take it serious early on. And one of the things a lot of us have been talking about is social distancing is a cool name, but really we should watch what we're saying. Because for me, I'm physically distanced from other people, and I like to use that term, physical distancing, because I'm actually more socially engaged right now than I've probably been in the last couple of years. I'm like talking to everybody all the time and using social for what it's meant for. So
totally. And Tom, a quick question. Once you've got it, if you've got coronavirus, you've got all the symptoms, say you go back to feeling normal again, are you contagious afterwards? Like, do we need to also be proactive about once we've had it? Like, we're immune now, but what about, are we passing it?
Well, what's interesting is we may not be immune, which is unfortunate. There are cases of reinfection with people who have just recovered, which is unfortunate. And also, we are hoping that we develop some short-term immunity, which will help us be able to bring this down. But there are cases where it's not, and we're trying to figure out, did the virus mutate? Did the person did we really not completely clear it, but we said they did? We know. So if you get sick, the number one thing you can do is to isolate, to do isolation. And we change the word from self-quarantine to self-isolation a lot of times, because you really should cut yourself off, even from the folks in your family, within reason. I mean, obviously, I live with Jill and Talia and some dogs and cat, and I'm like, the likelihood of us not being able to see each other ever is very low, right? But so if you're sick and you have a cough, that's the time to put a mask on. This crazy hysteria about all the masks. The mask is to prevent you from giving it to somebody else, unless you're a medical provider that has the proper fitting, because the masks, most of the masks that everybody are using aren't even close to effective for a coronavirus. And the medical masks that are used and can be moderately helpful have to be fitted properly. And unfortunately, we've seen such a rush on these things worldwide that our medical providers don't have access to it. And the people wearing them and using them, it's not helping them. It just gives them a false sense of security, and it's really not helping. So, but anyway, if you do get sick, put on a surgical mask or something similar at home to protect other people, or if you had to go out in public, which you really shouldn't be doing. But the one thing, and then it's usually mild, in a week or two, you'll be better. The only concern I have now is we've been telling people to self-isolate until they're better and they have no symptoms. But they've been seeing people 1 to 4 weeks out still can be shedding the virus. So, and in an intact, viable, infectious form. So we're really trying to figure out, what to do after that. The key takeaway, though, Shelley, is that the people who are most likely to be negatively to get other people sick are the people who are showing like severe symptoms. So the more sick they are, the more likely they are to pass it to someone else.
Okay. And can you just touch on the one more thing before I let you go, Tom, and join your family on your Friday night? Why are we not developing immunity to it once we've been affected by it?
Well, so we don't know 100% that we're not developing immunity. We just know that a few people didn't. And so one thing could be that the virus is already mutating. usually, because like if you think about seasonal flu, if you get it once, it's usually good for that year, but the next year it mutated, right?
Yes.
So we're hoping people develop that short-term immunity, but maybe there are some strains that are mutating. The other thing that can happen though too could be that those people really weren't all better, right?
Yeah.
We just said, oh, we think you're all better, but they really weren't.
Totally.
So we have to really.
Is there a way to test that you're actually better other than listening to symptoms? Because Tom, we know that patients lie about these things. Let's be honest. They lie to us about all sorts of things. So how do you know, like, is there a clear way other than listening to your body and saying, yeah, I'm better now, I feel better, I can do everything again? Is it just that they're sick of being isolated so they're better? Or how do we actually clear them for a good bill of health?
Yeah, I mean, this is definitely the time to work closely with your medical provider, because if you already have it, that's the time for you to follow their instructions. The good news when in somewhere like, New Zealand, where you probably, where it's kind of low numbers right now, your country is taking it very seriously, it sounds like, is even if it does start to spread a little bit more, you're going to have a ton more information than you had than we had back in January. Because just look at the news, like the information about who's going to be most at risk in the last 3 days has changed, and in the last week, we've looked at a lot more drugs that may be helpful. We have more information. So it's going to be ever evolving. Now, I don't want to startle or scare people. I mean, most people who get better are better and they feel fine. And they're probably not out there making people really sick. It's just that what we've learned from this is we don't want to jump on any one piece of information too quickly. What we want to do is do simple immune boosting things, which include some of the stuff we talked about, and diet. And also the other thing is chill out. You like Talia, our daughter Talia, who's 10. The other night she goes, "Daddy, everybody needs to remain calm." And I was like, "Oh, really?" She's like, "Yeah, because when your brain is going all crazy inside and stuff, you can't think rationally or scientifically." I was like, "You got it."
She's smart. I love Talia. She's a little powerhouse. She's a daughter of 2 doctors, Tom. Come on. Of course she's thinking like that. She's all over it.
I know. So, but it's so important to understand that understanding the true severity of the situation is power. Flipping out about it isn't going to help. And so do whatever gets you chill. Read a book, start drawing again, break out the paints, cook, meditate, prayer, whatever you love, pet your dog, sit there and give your dog an extra whatever it is that you really love and do. You need to do all that. And of any of the things that you guys can do right now, pick one thing that helps you chill out. Add one vegetable to your diet, add half an hour to how much you sleep, but do it today.
Add some water. How many
hydration
people
is critical.
I know, right, Tom? That's my message. And Tom, like, I am so grateful now more than ever that I'm in such a great group of functional medical practitioners that here in New Zealand, having you guys supporting us, because you brought us all of this information and we're getting it out there ahead of the times because of what you guys have gone through. Like, I am so grateful for your time, Tom, your knowledge, everything that my amazing American colleagues have been doing to support us here so that we don't need it as bad and we can learn from you guys and be more proactive.
Yeah, we definitely, proactive is the key. Calm down and start doing a little bit of stuff now. Who knows what it's going to look like, but I do know that we're going to get through this. The vast majority of us will get through this. We'll learn a lot more over the next weeks and months. But, what's really interesting to me about the whole thing is that it seems like this is trying to drag us apart. And it's such this horrible thing because we've had to do the distancing and all this stuff. But I've seen, as people take it more and more seriously, so many people are doing things that not only help themselves, but a lot of cases are helping other people more than themselves. And it's bringing us together. We have so many online meditation and exercise and yoga people. We have things like you're doing, and it's like everybody's giving. I mean, I've just seen, like I love doing Wim Hof breathing and stuff, and I wanted to take the course forever. And I'm like, oh, I don't have time. And then I just get a little blurb where it's like, oh, it's 50% off from now until like forever, basically, because it's so important for people to find what's right for them. And so many people are just giving. So we needed a shift and a wake-up call on the globe. And do I want it to be this way? Absolutely not. But man, everybody's stepping up.
Totally. So Tom, on that note, should we dance it out? We're
dancing it out for the very best.
Right? Tom, thank you so much. Send my love to Jill and Talia, of course, because, you know, social distancing, but I love them and I'll be in contact with Jill. But thank you for your wise words this morning and just really helping us understand it more.
Oh, you're so welcome. Thanks for having me. Everybody be safe and happy. Do a bunch of extra dancing, get those lymphatic fluids moving, and here's all the love coming from the US to you guys.
Thank you, Tom. I hope we learn from you guys. That's all you can ask, right? That we learn from you guys.
Take it seriously and stay healthy and have fun.
Thank you, Tom.
Bye-bye.
Bye.